Hello, thank you for viewing this presentation. My name is Janice Iglesias, and I am a health educator at the Student Health Center. Today, I will be sharing a presentation reviewing the services that we have available at the Student Health Center. So I wanted to start by giving a brief history about the Student Health Center and how we came to be. It really is a story of how students requested the campus health services, um, and that's how it originated. So back in November 1972, we had our students on campus who were looking at the available services on campus and noticed that there was a particular gap in reference to the health services that were available on campus. And so seeing that there was a need for a student health center on campus, these students went to administration, went to board, and put in that request and explained that need. And in 1973, the following year, they were successful and we had health services running. We started as a small operation. So in the parking lot, there was a trailer, and that's where our doctors and our nurses were administering health services. We began to grow as a program, and the need began to grow. And so we had a building constructed in 1978. It's the same building that stands to this day. We love our 70s building. And so that has been up. And fast forward to today, same building, even more students accessing student health services on average. We see about 7,500 student visits every year. These health services are funded by the health fees and existing grant funds. And so moving on to our mission at the Student Health Center is really about supporting students. So strengthening student learning, retention, and success by supporting students' physical, emotional, and social well-being by offering our accessible and high quality health services and programs. Um, at the Student Health Center, we really encourage students to prioritize their wellness, and we really understand that without good physical health and without good mental health, it is hard for students to learn and to be successful as students. And so that is what we are here to do, is to support students' overall mental and physical well-being. So question with who can access our health services. So we just have two requirements there. First one is that students must be enrolled in a current semester OCC credit class. So as long as students are enrolled in at least one class that is credited, they are eligible to access our health services. And then the other requirement is that once you are enrolled, you have to make sure that you are paying that student health fee for that current semester. So when you're signing up for classes and then going ahead and paying for classes, you'll see the health fee that pops up, and for the fall and spring semester, that is $21. And then in our summer session, the health fee is $19. So as long as students are fulfilling these two requirements, that when they are enrolled in a current semester class that's credited and they have paid the health fee for the current semester, then they are good to go. And with that, they can access our health services when they have paid the health fee and are enrolled. They can come visit us. We have our medical and mental health appointments. Those visits are free of charge because they are covered by the health fee that students pay. So students can come in and see us, and those visits would be free. The only additional charges that would accrue from a student's visit to the health center is if the student needs any additional services, such as a lab test, blood test, or any sort of other exams. So those two things, laboratory tests and any additional exams, would require a small fee. We also have a small pharmacy on site at the Student Health Center. So we do also offer low-cost medications to students if they need that after their visit. So looking at what students are coming into the health center for, um, here is a list of some of those common health needs that we are seeing with students. On the medical side, we are seeing students come in to be treated for colds and the flu, particularly around flu season and fall semester and during high stress season, such as during finals. We'll see a lot of colds and flus pop up. Um, Also, communicable diseases, urinary tract infections. Students are also coming in to talk with our nurses and our medical staff about birth control and STD testing, just sexually transmitted diseases. And then also coming in for injuries. So students are coming in for that as well. On the mental health side, we are seeing students and working with students on anxiety, stress, sexuality and relationship issues, helping them with sleep problems, um, and working with them on the academic pressure that they may be feeling, as well as any depression that they may be experiencing. So under the umbrella of student health services, we have four main areas of our services. So first one being our medical care services, and then we also have our mental health care services. We also do work in community and public health. And then we also have our health education services and campus outreach, as well as tobacco cessation services. So with each of these, I'll be going into more specifics about the services that are covered under them. So the first one up is our medical care services. So our medical staff, a primary role is to assess and treat students who are coming in with acute illness and injury. So acute meaning that this illness or injury has come on suddenly, but can also be treated um, readily. So such, for example, colds or flus. So our nurses are here to help students with that, to help them manage those acute illnesses, as well as to administer basic first aid if they're coming in for an injury. And then also to look at that, and if the students need any extended care beyond that, referring them to specialized care outside of the student health services. Our nurses and the medical staff also help students with providing tuberculosis screening and testing. So students may need a TB test that screens for tuberculosis, which is a bacterial lung infection. And students may need this as a requirement to be cleared for a class or a health program, or sometimes even for work. So students can come in and get that test done here with our nurses. Our medical staff also does management of any active TB cases if that does occur. Our medical staff also helps students with any physical examinations that they may need. Some students who are in certain programs, such as allied health programs or in any of the athletics programs, will be required to do physicals to be able to start those programs. And so they can get that done here at the Student Health Center. Students are also coming in to talk to our nurses and our doctors regarding sexual health questions. They can come in and talk to medical staff about that. Medical staff can also help them with STI screening, pregnancy testing, contraceptives, and consulting about safer sex practices. Also, medical staff can help students with any women's or men's health assessments. So they do gynecologic exams and testicular exams if needed. As I mentioned earlier, we do have a small pharmacy on site and a small lab. So we also offer any lab testing or medications that students may need. For example, if students may need some throat cultures or pregnancy testing or urinalysis, that can be done at the Student Health Center. And as far as immunizations, we don't do vaccinations here, but we do offer referrals where students can get that at low cost or sometimes for free elsewhere. We do, however, help students who are in allied health or in the housing to get health clearances for their immunizations. Actually, the one vaccination that we do is our flu vaccination clinics, and we offer that for free in the fall. Lastly, with our medical care services, students can come in to consult with our nurses and with our doctors about any health questions that they may have, or if they want to discuss any new health goals, they can do that with our nurses. So we really focus on having a holistic approach to health, so students can come in and have those questions answered by our nurses. Okay, as far as how to access our medical care services, right now we're doing things quite differently, considering that we are in a pandemic and we've had to shut down 100% services that we usually do. So right now what that looks like is a mix of appointments via telehealth, where you will talk to the nurse over the phone, and then also some limited in-person appointments where you are coming into the health center and being seen by the nurse or the doctor. And so with that, and following COVID-19 prevention guidelines, students are only being seen on an appointment basis for both telehealth and in-person appointments. So students, if you are interested in making an appointment to see our nurse and to talk to our medical staff, we'll first call our nurse appointment line listed there on the screen. So 714-714-7705. So the nurse will be on the other end and will do that initial assessment and either refer you to an appropriate provider outside of the health center or have you come in to see our doctor here in person. And those in-person appointments are only done on Mondays and Wednesdays. Okay, again, this is our number for our nurse appointment line. And please note, leave a message for non-emergencies during regular office hours, and our uh, one of our nurses will call you back and work with you to determine what your next steps are for getting the healthcare that you need, and any referrals that you may need. Okay. Now moving on to our mental health care services. So we have our mental health staff here at the health center available to help students um, with a variety of issues ranging from relationship issues, anxiety, substance abuse. So students can come in and work with our therapists in our short-term therapy services. Uh, Our mental health staff also provides crisis intervention. So sometimes there are situations where students may not be able to wait for a mental health appointment and are not able to wait to be seen by a mental health therapist because their mental health needs at the moment are um, urgent and are considered an emergency. And so we have our mental health staff do crisis intervention. So helping those students who need that immediate help with a mental health issue. And with our services, we are short-term therapy. So if students may need more longer term care, our mental health staff does refer students with community resources that they can link and continue that mental health care at a low cost. And our services and counseling sessions are all confidential. The only instances where that confidentiality may be broken is if the student um, is identified as high risk to themselves or to others. Otherwise, all of the counseling sessions are confidential between student and therapist. The other mental health work that our staff does is working with the community and our campus um, with groups and workshops. So our mental health staff does provide group support for certain OCC programs such as Care and Guardian Scholars, and working with those students in those programs. And they also do workshops for the entire campus community. On the screen there, you see some of the mental health staff. In the middle image there is Laura, one of our therapists, and uh, in that picture she is doing her mental health workshop and doing her fun feather activity. Um, right, and as far as how to receive mental health services at the Student Health Center. So again, we're doing things a bit differently because of the pandemic, and we've had to temporarily suspend in-person visits. We're not able to practice COVID-19 prevention guidelines with the smaller rooms that we currently have for counseling. So not able to have that safe 6-foot distance. So we do have to have our mental health appointments via telehealth only. And the way to start mental health services is to call our mental health line. So you can call or text that number on the screen there. So 714-432-6858. You'll be connected with our mental health team director, and they will set you up with a counseling plan and connect you with one of our mental health therapists. Along with our medical care services and our mental health care services, we also focus on protecting our community, our campus community, and doing some public health work. And that includes our behavioral intervention team, shortened as BIT. So BIT is a team comprised of key personnel on campus who help students who are in distress and help mitigate those classroom situations. And so it is a collaboration between different key areas on campus who are working together to assist that student. In addition, we also have support services, so supporting students who may have experienced sexual misconduct or assault, and connecting them with support services and referrals. We also help students on how to access and sign up for health insurance as well. Lastly, we also do preceptoring and internships. So students who are in medical assisting programs, nursing programs, or in mental health programs in our local college programs may do their internship hours or preceptoring hours here at the Student Health Center. So often we see OCC students sometimes doing a full circle of starting their college career here at OCC, and then going on to a nursing program or a medical assisting program, or getting their degree in psychology, and then coming back here as an intern or a nursing student, getting their hours, and so doing that full circle coming back to OCC. Actually, in community and public health, one of our focus is protecting our campus community. So making sure that we are preventing spread of infectious disease. So our medical staff does case management of infectious disease right now. That is those cases of COVID-19. In addition, we also do annual free flu clinics. We couldn't do that the last year due to the pandemic. We usually have our free flu clinics, and students and staff are coming in to get their free flu shot. So we couldn't do the bigger clinics that we usually do, but we are offering free flu shots to students if they are coming in for appointments. Yes, so our big focus right now with community and public health is getting the information and the resources out to our campus community. We are posting that information and that list of resources and referrals on our website. So we want to make sure that we are protecting our OCC community and helping them get that information and stay protected. Okay, yes, so back to the free flu shots. So not doing the clinics, but we do have appointments where students can come in to get their flu shots. So students can call that same nurse appointment line, 714-714-7705, and can make an appointment for either Mondays or Wednesdays to come and get their flu shots. And students will complete a COVID-19 screening and consent if they are coming in to get their flu shot. Okay. So moving on to our health education services, along with our medical and mental health services that we offer students, we also focus on telling students to stay healthy with prevention measures. So our key focus with health education is addressing those priority health issues that we see in the student population, such as stress, alcohol use, and safer sex. And so talking to students and helping them gain awareness and knowledge about certain health topics, and letting them know various ways that they can stay healthy. And so we do this, well, pre-pandemic, we've done this with our campus outreach. So we go on campus and we have various health events, such as our health resource fairs. We've done various awareness campaigns, um, and have done different tabling activities. And then we also go out and do classroom presentations and let students know about different health issues. We also have a peer health education program. So this is comprised of different student leaders who are really committed to supporting the well-being and academic success of their peers. And so this is a really unique program where we're utilizing that powerful relationship that peers have with each other, and influencing the attitudes and the knowledge that students have about different health topics. Under health education, the newest service that we have launched is our tobacco cessation counseling services. This is in line with the OCC smoke-free policy that passed in last summer. And we want to make sure that we are also supporting any smokers who are looking to quit vaping or smoking. And so those students who are interested, they can choose among seminars, classes, or if they prefer one-on-one, we also have individual counseling. In the program, students will work with me on exploring what their tobacco triggers are, and how to cope with withdrawal symptoms that may come up in certain situations, and where they may feel the urge to pick up that cigarette again, or that vape pen again. Yeah, and with our counseling sessions for tobacco cessation, these sessions, they are free, they're confidential, and they are open to not only students, but OCC employees as well. And as a student or employee is going through the tobacco cessation counseling program, once they are done, I will do some follow-ups with them just to see how they're doing and see how we can assist them as they continue along their quit journey. So right now, again, having to move to telehealth services, and because of the pandemic, the tobacco cessation services are available through phone or video conferencing. And the number to call is 714-432-6832. So if you are interested in quitting smoking or vaping, or just want more information about the program, or have any questions, you can call that number. And then back to our Pure Health Educator program. So a lot of the campus events that we have done and awareness campaigns that we have launched for the campus have been led by our Pure Health Educators. These are students who are committed to promoting healthy behaviors and lifestyle choices among their peers, and really want to support the well-being and the academic success of their peers. So those are just a few images of some of the past activities that they've done. We usually bring out our health hut that you see in the picture there, and the Pure Health Educators have their information and a fun activity out and are talking to their peers about different health topics. In our health education activities, we do big focus on um, mental health awareness and making sure that we are providing uh, those activities and that support for students. Um, again, as we uh, have recognized that without good mental health, it's hard for students to learn and be successful. And so we typically have a series of mental health initiatives that we do in the fall semester. We do our suicide prevention fair in September and our substance prevention fair in November. And then we also do our movies for mental health workshop for the students. Um, in addition to mental health awareness, we do various awareness campaigns, such as in October, we do what's called our Pink Power Day or breast cancer campaign. So talking to students about breast health and when to see a healthcare provider if they are seeing any sort of signs or um, concerns there. So that's a really fun day where we ask the campus community to wear pink and come visit our booths to learn more about breast cancer and how to reduce your risk. We also focus on educating and bringing awareness about alcohol and talking to students about preventing impaired um, driving and making sure that they know what binge drinking is and how to stay safe. So those are just a few pictures from our breast cancer Pink Power Day at our photo booth, and then one of our peer health educators in the picture below for one of our alcohol awareness events. Okay, so like with everything else, we've had to move our events and our health education activities online. And so we are doing things virtually. So we are still providing these activities where students can connect with each other and explore more about mental health. Um, for our spring 2021 lineup of virtual events, that includes our guided meditation and relaxation series. This is a collaboration that we are doing with our student life and leadership department and is being led by one of our OCC instructors. Her name is Linda Salim, and she is awesome. And we are having students join us for weekly sessions on Tuesdays where they can follow along with Linda to discover some simple ways where they can let go of physical tension and release some negative emotions. Um, so that is our guided meditation and relaxation series we're doing this spring. Um, our next event that we are doing that is coming up next month is our Movies for Mental Health workshop. Um, that is a virtual workshop that we are hosting and is being facilitated by Art with Impact, which is a nonprofit organization that utilizes the power of film to initiate dialogue among students about mental health and to break down that stigma of mental health. And so in the event, students will view some short films and discuss those short films. They will also engage in various um, mindful activities and mental health activities, and will also be able to view a panel discussion with students, with OCC students who will share their own personal mental health stories, as well as representatives from local mental health resources who will share their services. So that is our Movies for Mental Health workshop that we are doing next month. We also have what's called our trivia time with the Student Health Center campaign. So this is an online series where students will take quizzes about different health topics and learn more about healthy behaviors that they can adopt. So these are just some of the fun activities that we have moved over to the virtual sphere and are providing online for students. Okay. So that rounds up our health services here at the Student Health Center, our medical care, mental health care, the work in protecting our campus community and public, um, and then lastly, our health education and outreach programs and events, as well as our tobacco cessation services that we just launched. So after accessing these services, you can log into our student health portal. If you're ready to make an appointment, you can log into the portal and complete those health forms online. It'll save you time and is a great way for you to view your appointments and any educational handouts that you want to review there. It is also where you can view and print your lab and any TB test results there. Okay, and as far as when we are open, so Monday through Thursday are the days from 8:30 to 12, and then we're ending at 5, and then Fridays are for appointments only. And then we are closed on the weekends and during any college holidays, as well as during any semester breaks. And as far as where we're located, we are between Watson Hall and the gym. So just directly across parking lot A. Okay. And then again, with confidentiality, all medical and mental health records are confidential. So your health records won't be released to anyone without your written consent, except in cases where it is required by law. And medical and counseling sessions are confidential unless you are identified as a high risk to yourself or to others. Okay. And then to review the numbers on where to reach us for our nurse appointment line and to start medical care, you'll call our that line there, 714-714-7705, to connect with our mental health staff. And if you are interested in starting short-term therapy, you can call or text 714-432-6858. And then if you are interested in quitting smoking or vaping, you can connect with me, and that is my number, 714-432-6832. And then the best way to stay connected with us in terms of information that I reviewed and information and referrals for COVID-19, you can log into our website there and we'll find our information. Okay, and that about wraps up an overview of the services at the Student Health Center. I'm going to end there and wish you the best in your college journey. Thank you.